But of course, markets can fail. One example might be we have price setting and not price taking. In other words, monopoly, which I showed you. Another example is externalities. And another example is public goods. And I'm going to move on to talking about them in a minute. Another way in which markets fail is we have imperfect information. Touched on one example of this in the very first lecture with supplier inducement. Remember this idea of an asymmetry or imbalance of information between healthcare providers and patients or consumers. That's imperfect information. Another potential problem, this happens in health insurance, among other areas, is something called adverse selection and something called moral hazard. But I haven't, again, it's a whole lecture in itself. So there's these reasons why markets can fail. Let's look at externalities. Now, maybe we get on firmer ground here, get a little bit near public health. Seem appropriate where we are. Good example of a positive externality is vaccination. An example of a negative externality would be air pollution. Or, again, moving closer, maybe closer to public health, or even closer to public health, passive smoking. Although I think air pollution is probably pretty close to public health, or it should be. Let me explain these. Right, with a positive externality, too little of the activity is undertaken. There's not enough of it. At the private equilibrium, at that point that we'll get to, if we just leave it to the market and just leave it to individual decisions of consumers and producers, the marginal social benefit is greater than the marginal social cost. In other words, we've got an opportunity by doing a bit more to get some additional benefit and enough additional benefit to compensate us for the additional cost, or more than compensate us. An example of this might be because the marginal social benefit of an activity exceeds its marginal private benefit. Now this would be the example in vaccination. With an externality, on the other hand, we've got too much of the activity happening. Too much is, again, at the private equilibrium. If we just leave it to firms, individuals, we don't regulate the market, a negative externality will have too much of the activity. At the private equilibrium, the marginal social benefit is less than the marginal social cost. And so that last unit of activity is producing, if you like, more harm than benefit, and thus making us worse off. One example might be the marginal social cost exceeds the marginal private cost. So, for example, a firm producing some sort of manufacturing output doesn't just produce the units of the output, but they also produce waste products, which either they release into water courses or they release into the air. Now, what's happening is they are thinking, when they look at their private marginal cost, they're thinking of how much they pay the employees to work a bit more, how much additional units of raw material they need, how many more machines, etc. they require. But they're also, because they're producing these waste products, they're imposing another cost on everybody else in terms of air pollution. And that's part of the social cost, but it's not part of their private cost. They're not thinking about that. So that's a problem. And so they push the activity too far because they haven't taken account of all the costs. I can give you another graph. Positive externality, again, higher price, greater quantity supplied, lower price, greater quantity demanded. So, imagine an individual who's thinking about, suppose we're looking at, the Q here could be vaccinations. So individuals are making decisions, if we left it all to the market, individuals would look at the price of a vaccination, obtaining a vaccination, they would think, what's the benefit to themselves of a vaccination? Now, if the price was very high, some people would get vaccinated. They would think, yes, this is worth it, I want to protect myself, but not so very many. At lower prices, more people would choose to be vaccinated. But the point here is they're thinking, we argue, of their marginal private benefit. They're thinking of the protection the vaccination gives them. But of course, every time one of us is vaccinated, while we benefit, in principle, we give a benefit to other people. And given your background, you'll be familiar with notions of herd immunity and things like that, which I won't go into. And so, the marginal benefit to society, the marginal social benefit from vaccination is up here somewhere. It's above the private benefit. Because there's a benefit to the private individual getting the vaccination, but there's then also a benefit for other people. And so the marginal social benefit is higher than the marginal private benefit. And so rather than being at this point here, with a price PE and QE quantity, it would be better for society to expand the activity out to Q star. And at Q star, the marginal benefit from the last person vaccinated is just equal to the marginal cost of supplying the vaccination. So that's an example of positive externality. And the relevance here is, if we leave it to the market to determine, we expect to end up at QE, or somewhere like QE, not at Q star. Goodness me, I'm going too slowly. But we've got time for questions. Come on. Any questions about this? Or is this bit blindingly obvious? Okay, well, hold on to that. Let's hope it's... The danger here is, because you're quiet, it's rather than being absolutely obvious and simple, you're feeling a bit lost and... okay. Yes?
I was still wondering about that, the willingness to pay in the healthcare. Does this mean that the cost benefit will be better than cost utility and better than cost effectiveness?
Ooh.
Consider about the cut-off line benefit.
All right. So, well, cost benefit, cost utility, cost effectiveness are different methods of economic evaluation, and the difference, I realise this is for everyone's benefit, not just for you, I realise you realise this, the difference is with cost benefit, you're valuing the benefits in money terms. With cost utility, you're valuing it in terms of maybe QALYs gained or DALYs prevented. With cost effectiveness, you're using some sort of more physical measure, like myocardial infarctions prevented or hip fractures prevented. I think it's fair to say that from an economist's point of view, life would be sort of almost easier if we were able to put money values on the various benefits. For various reasons. For one reason, it's then easier to compare to the costs because they're in the same denomination. It's also then easier to make comparisons between activity in the health sector and in other sectors of the economy. However, there's a number of reasons why it's very challenging to put monetary values, money values, on health benefits. There are some methods. Again, that's a whole lecture, or in fact, I could give you 3 lectures on it. There are methods, but there are challenges. I think it's fair to say that health economists have, if you like, almost pushed things like cost per QALY and the quality adjusted life year because they probably thought they could get buy-in from the rest of the world on that. It's still a long battle, but some measure of years of full health has a sort of strong intuition to it. If we think of intuition, for most people, the idea that you could actually say, and it's worth this much money for this person not to have a stroke, that makes people very uncomfortable. And I think justifiably. I think the justification is that our methods are not really quite good enough. And so we've ended up with a focus on measures such as QALYs and DALYs, whereas perhaps it might be beneficial in some senses if we had money values for these benefits. I don't know if that sort of answers your point. And when I'm talking about these curves, of course, this is a money value. I'm talking about how much is someone willing to pay for a vaccination or for the health benefit that a vaccination brings. Okay. Negative externality, well, we don't have to spend a lot of time on this, but the same idea. What's happening with in the opposite direction, what's happening is the producer is thinking of their private costs, and so we have a decision to produce at QE, but perhaps there's not just private costs involved, perhaps there's costs imposed on other people, the example of air pollution, in which case the cost, marginal social cost to society of the activity is not down here, it's up here somewhere. And so if the producer was then to take into account their impact on society, well then we would expect them to produce less. Back to our smoking example. If you leave it, the producer here is the individual smoker. If you leave it to them, they will be by and large thinking of how much they are enjoying or whatever that next cigarette. They may not be thinking, and what impact am I having on those around me? If they thought about the impact on those around them, they might not have that cigarette. And so if we leave it to the market, we have too much smoking. Hence, we have all sorts of policies about trying to restrict smoking that different governments have introduced. So there is, I hope you get, there's quite a strong read across from these theoretical concepts to actual real policies and real decisions. There's sometimes arguments that there's actually a very special sort of externality in healthcare, and that's a caring externality. It's suggested that some individuals may feel better off knowing that other individuals are getting healthcare that they need. So we may not just be concerned with our own health and our demand for healthcare. We may value knowledge, knowing other people have access to healthcare. Thus, as more healthcare is provided, not only does the individual who gets the healthcare gain, but maybe we all gain. This is beginning to drift slightly back towards social capital, possibly. I'll try and tie it in more closely later. Now, this is different from the vaccination example. If more people are vaccinated, I am actually gaining. This example is other people get access to healthcare, and I'm just feeling better off because I've got that knowledge. Now, we don't have a lot of evidence of this, but there have been some studies, using willingness to pay actually as a method, which have shown that people are willing to pay a certain amount to provide benefits to others. There's quite a famous study conducted in, it was southwest Nigeria, well, it was in Nigeria anyway, and it was looking at insecticide-treated bed nets. And it established that there was some positive willingness to pay from individuals to improve access to insecticide-treated bed nets for other people. So there are a few examples of that, but maybe this is just a nice idea. maybe it's not real. I don't know. I think it is real. I think it's just quite hard to provide the evidence for it. Well, jargon. We talk about internalizing externalities as we're getting rid of them, internalizing them, bringing the externality internal to the decision. So making the producer think about the costs they impose on others, making the individual who's receiving the vaccination think about the benefits to others. Now, or in effect, think about the benefits to others. Now, what you could do is just have a campaign and posters say, get vaccinated, save someone else's life. That might work. Easier in this context would be subsidise the price of the vaccine, because then we'd expect as price or the cost to the individual getting vaccinated, as that goes down, more people get vaccinated. Or if it's not just subsidise the price, just make it easier for them to get vaccinated. You could have campaigns where you go to workplaces or whatever. So there are ways of internalising externalities, and one solution is either to tax the activity, the bad activity, negative externality activity, or to subsidise the good activity, the positive externality. And so you're ensuring that individuals, firms and consumers get the right price signal. Because the problem here is they're getting the wrong price signal just now. Yeah, so I won't dwell on that. That's just putting it in words. There is a problem with this. What level do you set the tax at? Or what level do you set the subsidy at? You might over-subsidise something and you could have too much of it. And of course it's costly to administer such a system.